The urgent new alert issued by the CDC warning against buying ADHD medications outside the healthcare system in the middle of ongoing shortages. So joining us now with more on this, ABC News medical correspondent Dr. Darien Sutton. Thank you for being here, Darien. Okay, so break this warning down for us.
Yeah, so this is a big problem. Estimated 9 million people living with ADHD in this country are paying attention to this. So this is due to a large shutdown of a large telehealth company by the Department of Justice. It has added more limitations in terms of access to these needed ADHD medications. Again, more than 9 million people are estimated to have this diagnosis, and it's leading many, understandably, to desperate measures, which is why I think it's so important to take a moment and to remind about being cautious. A lot of these counterfeit medications that people are seeking out can look identical to the regular medications. It's incredibly dangerous. They can sometimes have contaminated substances, for example, fentanyl, and they can also be variable doses, and so you might not know what amount you're taking, and it can expose you to the risk of overdose.
So what can parents do if they find themselves in this situation to make sure they're getting the medication that their kids need?
Well, I think, number one, this is a growing problem, an ongoing problem. This shortage has been going on for 2 years. Medications like Adderall, Ritalin, Vyvanse have been very difficult to get, and many people do not know that this diagnosis is debilitating. So for parents, I would recommend to make sure that you get a close relationship with your pharmacist. Also remembering that pharmacies have different wholesalers or different pharmacy chains. So make sure in your community that you're aware of all the different pharmacies because they might have variable supply. And then also checking with your insurance company because in light of this shortage, some insurance companies have added brand names to their formulary so that you might have that benefit and you just might not know.
And if you can't get the drugs, are there any alternatives here that are available?
Well, there are definitely non-stimulant alternatives, and it's an important conversation to have with your provider. Also, there are generic options, which many people might not have tried yet. And then also, besides that, understanding the lifestyle changes that you can do and working with your doctor. For example, making sure, of course, that you're getting regular activity. If you're an adult dealing with ADHD, limiting alcohol. And for both adults and children, making sure that you're getting enough sleep. And then also beyond that, many parents ask the question of, it's summertime, can my child take a break? And when I've consulted many of my friends who specialize in this, many say it can help for some and it can harm others. So make sure that you're working through that with your physician.
It's such an important topic. I'm so glad that you're here to talk about it. Thank you
really
so
important.
much, Dr. Darien Sutton.